novel 3-dose G protein vaccine ultimately for compliance. Next slide, please. Globally, 59,000 human deaths annually.
Yes, sir. Continue, sir.
Globally, 59,000 human deaths annually, highest in India. India is 20,000 human deaths a year from rabies, accounting for 60% of the rabies death in Asia and 35% globally. 91% deaths in India occur in rural areas. Current management includes local wound treatment by the first aids. Second is active immunization by the vaccines, which we are giving, and passive immunization in the form of rabies immunoglobulins. Nowadays, 5-dose intramuscular regime was practiced by all of us. That is IM dose on 0, 3, 7, 14, and 28 days of the life of the bite. Next slide. Current challenges of the post-exposure prophylaxis. First is non-compliance. Second is current rabies vaccines are cell-cultured vaccine. Inactivated vaccines are more than 50 years old technology. So there is inconsistency in potency, stability, availability, because there is short supply and adverse events. Next slide, please. Compliance of the anti-rabies vaccine. Compliant means who received the full course of anti-rabies vaccine that is scheduled in the ARB on the recommended dates. Delayed complaint means who completed the scheduled dose of ARB within 16 days but deviated from the scheduled regime. Dropout or non-compliant means who had taken at least one dose of ARB after annual bite but not completed the scheduled dose as prescribed. Next slide, please. Rabies post-exposure prophylaxis in routine practice in view of new centers for disease control and prevention and WHO recommendations. A retrospective analysis was done at the travel clinic. A total of 110 patients who received rabies 4 doses post-exposure prophylaxis were done. Shortcomings in the management of these patients: late initiation of rabies post-exposure prophylaxis, administration of human rabies immunoglobulin antibodies level. Conclusion was that patients do not always receive optimal rabies post-exposure prophylaxis under real-life condition. A significant proportion of patients did not develop adequate antibody level even after 4 doses of vaccine. Next slide, please. This is just a chart showing the details of the hospital. Next slide, please. Compliance of the post-exposure prophylaxis among animal bite patient. A hospital-based epidemiology study at Safdarjung Hospital, New Delhi. 300 animal bite patients were included. A pre-designed, pre-tested, structured questionnaire was administered by the interview technique. 53% were non-compliant to the full course of anti-rabies vaccine. This is a very significant percentage which shows more than half of the patients do not comply with the schedule which prescribed by us. Compliance to the anti-rabies.
1 minute, sir. Sir, only 1 minute. Technical team is there. तो टेक्निकल टीम आप थोड़ा सा स्लाइड को आगे करते चलें. एक ही स्लाइड शो हो रही है उस पे.
9 number of slide, please. Compliance
technical
of
team,
the
9 number of slide.
Compliance of the anti-rabies vaccination in the post-exposure prophylaxis. At Municipal Corporation Hospitals, Bangalore, 215 animal bites where patients were included. 1 dose of rabies vaccine was administered IM on the days 0, 3, 7, 14, 28 days. All measures constraints for the compliance to complete the course. The compliance rate for the IM rabies vaccination was only 60% in spite of all the rules and regulations. Next slide, 10 number slide. Constraint for the compliance to complete the course of anti-rabies vaccine. Major cause were loss of wages in the rural areas, 47%. Interference with the school timing, 11%. Distance to the hospital, 11%. Cost incurred was 13%. Forgotten days, and 18%. These are the major constraints for the compliance to complete the ARV was loss of wages. 11th slide, please. Now coming to the evaluation of the rabies vaccine. 1885, live attenuated vaccine, it was given in the spinal cord. Then comes the inactivated vaccine, brain up to 10% in 1911. In 1976, inactivated vaccine, cell culture, more than 2.5 international units was administered. Non-compliance led to the evaluation in the treatment regime from 31 doses to 5 doses and still on. Next slide, please. Meeting the unmet medical need, introducing a novel vaccine with a short and simple regime. Next slide, please. 13 number slide. Novel 3-dose recombinant rabies G protein vaccine. First protein subunit vaccine prepared by the VLP platform technology. First vaccine with 3 doses intramuscular regime 037 days. Better compliance due to easy to flow regime and convenience, ready to use. Next slide, please. This is just the VLP technology described in detail. It is not to be understood in so much detail. Next slide. Clinical phases. Clinical phases. This is also not of much importance for all of us. 16th slide. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as stimulated post-exposure immunization. This study was done. Next slide, please. To evaluate the immunogenicity and the safety of rabies G vaccine, protein vaccine administered as a stimulated. In this 037 days regime was seen and 533 subjects were included. A total randomized trial of 800 subjects was cleared. Efficacy. 18 number slide. The results were consistent across the different age groups and genders. Observed difference was 1.52 with pre-specified margin of -4%. Novel 3-dose has a better safety profile as compared to the reference vaccine. And it is always preferred that 3-dose vaccine is much better than 5-dose vaccine. 19 number slide. The study concluded novel 3-dose was non-inferior to reference vaccine, led a less adverse effect compared to the reference vaccine. It was found to be safe, immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccine. 3-dose vaccine was given Pharma Innovation of the Year Award by the Economic Times and by the Golden Globe Tigers Award Malaysia for the Innovative Product of the Year. Thank you.
Next slide. Technical team. Finally.
Completed.
Yes, sir.
Thank you.
Sir, sir, thank you, sir. Thank you so much, sir, Dr. Sanjeev Mahimani, for this information. To really appreciate for your efforts. Last but not least, but we like to inform you that rabies has won 2 publications of the out of innovation category in India Pharma Awards and Golden Global Target. So thank you, sir. Thank you very much to innovation for this webinar, sir.
Thank you. Thank you.
Thank you, sir. Thank you. लाइव बंद कर दीजिए टेक्निकल टीम।